Hey sir, my name is Caitlin. I'm gonna be your student nurse today. Can I get you to verify your name and date of birth for me?
Nick Ferris, 3892.
Okay, so I'm gonna provide some privacy and I'm gonna do my hand hygiene. So your doctor has asked me to come in today to do just a couple assessments on you. So we're gonna do a cardiac and respiratory assessment. We're gonna do a neuro assessment, a musculoskeletal assessment, a gastrointestinal assessment, and we're also gonna look at your head, ears, eyes, nose, and throat, okay?
Okay.
All right, so we're gonna go ahead and start off with your respiratory assessment. So just looking at you, you don't look like you're having any trouble breathing. Do you feel like you're having any trouble breathing?
No.
No? Okay. All right, I'm gonna go ahead and listen for your, I'm gonna listen for your, listen in your lobes of your lungs, make sure we don't hear anything. Can I get you to scoot up and sit up for me just a little bit? Okay. All right, so in your right upper lung, take a deep breath. Left upper lung. Left lower lung. Right middle. Okay, and I'm also gonna check your sides. So right here, your right lower lung. And your left lower lung. And I'm gonna do the same on your back. So take a deep breath. And one more. Okay, so all that sounds really good. I didn't hear anything, nothing to worry about. So just to make sure that we can prevent any kind of mucus buildup, we can keep your lungs open and expanded, we want to do deep breathing and coughing. So what that means is you're gonna take a deep breath, open your lungs up, hold it as long as you can, and then blow it out. And then another thing we're gonna do is take a good deep cough into our elbow. So can you do that for me? Okay, and I don't see any kind of sputum, I don't notice any kind of mucus or anything. If you feel like the coughing and deep breathing isn't helping, we can also look into getting the doctor to order an incentive spirometer for you, and that's just a little device, and he'll set a goal for where he wants you to have it at. So you'll take a deep breath like we showed you, and it'll make the spirometer move up, and you'll be able to physically see it, and that just lets us know where you're at as far as reaching your goal. But that'll help keep everything kind of open and prevent any kind of mucus buildup. Do you feel like you're having any trouble breathing? You said no, right?
No.
Okay, so we're gonna move on to your cardiac assessment. Are you having any kind of chest pain or anything?
No.
Okay, so first I'm gonna start looking at your jugular vein distension. So if you tilt your head back and then just turn it to the side for me. Okay, I'm gonna check the other side. All right, so that looks good. Now I'm gonna listen to your heart sounds. Let's see. So I'm gonna start off with your aortic pulse right here. I'm gonna move to your pulmonic, then your Erb's point, your tricuspid, and your mitral. Okay, I'm gonna do the same thing, but this time I'm gonna listen for any murmurs, okay?
Okay.
Okay, so all those sounded really good. Now I'm gonna check your pulses in your hand, and I'm also gonna check your capillary refills in your fingers. So if I can just see your wrist. Okay, so I would rate that pulse about a 2, which is very normal. Same with that one. Now if you'll turn your hands over like this for me. Alright, so those look really good. They refill within the normal range. Now you also have a brachial pulse, axillary pulse, carotid pulse, a femoral pulse, and a popliteal pulse right here behind your knee. We won't check those today, but those are just for you to know. They're there if you'd ever like to check them, or if somebody ever asks to check your pulse in a different section. I am going to check your upper arm for any kind of edema or fluid buildup. Okay, so that looks good. Okay, now I'm going to move down to your lower extremities. And again, I'm going to check your pulse on your top of your foot, your ankle, and I'm going to check your capillary refill on your toes, okay? And then I'll also check up your leg for any kind of edema fluid buildup, okay? Okay, so if you just want to bring those feet out for me, you can lay them flat. Okay, so I'd rate that pulse about a 2. It's normal. Okay, so I'd rate that pulse about a 2. It's normal. Okay, so I'd rate that pulse about a 2. It's normal. Okay, so I'd rate that pulse about a 2. It's normal. Okay, so I'd rate that pulse about a 2. It's normal. Okay, so I'd rate that pulse about a 2. It's normal. Okay, so I'd rate that pulse about a 2. It's normal. Okay, so I'd rate that pulse about a 2. It's normal. Okay, so I'd rate that pulse about a 2. It's normal. Okay, so I'd rate that pulse about a 2. It's normal. Okay, so I'd rate that pulse about a 2. It's normal. Okay, so I'd rate that pulse about a 2. It's normal. Okay, so I'd rate that pulse about a 2. It's normal. Okay, so I'd rate that pulse about a 2. It's normal. Okay, so I'd rate that pulse about a 2. It's normal. Okay, so I'd rate that pulse about a 2. It's normal. Okay, so I'd rate that pulse about a 2. It's normal. Okay, so I'd rate that pulse about a 2. It's This one I'd also rate about a 2, pretty normal. If you'll bring that foot over for me. Same, normal, just good pulse. And that one as well. And I'm gonna push on your toes and just check your refill again. Okay, and then we're gonna check for any kind of edema. All right, so everything seemed really good with that. Now I'm gonna move over to checking your head, ears, eyes, nose, and throat. Just from observing right now, your head looks normal, very symmetrical. I don't notice any kind of enlargements or anything. Have you had any kind of recent head trauma or pain, headaches, anything like that?
No.
Okay, so after hand hygiene from touching your feet, I'm gonna put my gloves on, and I'm actually gonna push kind of on your head a little bit just to make sure I don't feel any kind of enlargements, masses, anything like that, okay?
Okay.
Okay, so everything feels very normal. I'm gonna look at your ears. Now, just first glance, they look average, normal in size. We can also tell that because the corner of your eyes will line up with the top of your ear. So that's why you can tell it's symmetrical and normal. Next, we're gonna move to your nose. I'm gonna come back and check your pupils in just a second, but we're gonna look at your nose. Looks pretty normal and symmetrical. If I do wanna just kind of test your, what is it called? I want to test your nasal patency. So I'm gonna have you just kind of close one nostril and breathe it out the other one, and then do the same for me. Can you use your finger and push on it for me? Okay, other side. Okay, did you feel any kind of like sinus buildup, any trouble breathing doing that?
No.
Okay, have you had any kind of sinuses or any issues prior to this?
No.
No, okay. All right, and I'm also gonna just move down to your lips. So just first glance, they look moist, they look normal in color, they look even in size, which is good. And what I'm gonna have you do is open your mouth for me. Just gonna check the inside, check your oral mucosa, and see how it looks, okay? So, okay. I need to see your bottom teeth if you'll bring your tongue in for me. Okay. So that looks good. Everything, again, looks pink and moist inside, looks very normal. I've noticed your teeth are white. I didn't see any kind of decay, no breaks in them. Let's see. Now we're gonna move back to your eyes. So just noticing first glance, I see that your irises are normal. They're blue in color. Your pupils are round and equal, and your scleris is white, which is normal, because if it was like pink or red, that could be a sign of like conjunctivitis, like pink eye or anything. So that's a good sign. Now what I'm gonna do is perform a test, a Perla test, and that test if your pupils are equal, round, react to light, and if they accommodate. So I'm gonna take my light and I'm gonna shine it in one eye and the other eye, and I'm just gonna watch for how they constrict, okay? First I'm gonna take and measure how big your pupil is before it gets any kind of light dilation. So they measure about a 4, which is normal. Normal range is 2 to 4, so that's good. Before we shine the light in, what I'm gonna do is I'm gonna hold my pen right here, and this is just a check for accommodation. So I'm gonna hold it right here, and I'm gonna bring it in and watch as your pupils react to it as it comes closer, okay? Okay, so they do constrict as the object gets closer, and then they go back to normal as it gets further away, which is normal. And so now I'm gonna do the light test like I showed you. So if you just look straight, and I'm gonna shine my light and then watch your pupils. Okay, I'm gonna move to the other side. All right, so those look good. They constricted like they should. So what that means is, as I shine the light in this eye, it constricted to 100%, and this one constricted to about 50%. And then as I swap the affected eye, this one constricted to 100%, and this one swapped over to 50%. Have you had any kind of issues recently with like any kind of hear loss from when we were checking your ears out earlier? Or have you had any kind of vision issues? Do you wear glasses or contacts normally?
No.
Okay, good. All right. So now I'm gonna check your neck. We just wanna make sure there's no abnormalities, which looking at it visually, I don't see anything. I don't see any kind of masses, no enlargement. Your shoulders look very even and aligned, which is good. Do you have any kind of issues with like range of motion as you move your neck?
No.
Can you show me that you can move it? Okay, so no problems or pain there?
No.
Okay, good deal. All right, so what I'm going to check now is your throat. So I'm going to hand you a cup of water, and I'm just going to hold right here in your trachea as you swallow. So this just helps us check that your trachea is midline, and there's no issues as you swallow anything, okay?
Okay.
So here's your water. Okay, so that felt really normal. It felt like you didn't have any issues swallowing. Did you feel like you had any problems swallowing?
No.
Okay, good. All right, so now we're going to move on to your neurological exam. I'm going to ask you a few questions just to kind of test your alertness and how oriented you are. So do you know where you are today?
Yes.
Okay, do you know why you're here?
Yes.
Okay, do you know who your current president is?
Yes.
Okay, all right, so that lets me know that you're awake, you're oriented, and you're alert, which is good. That goes along with the Glasgow Coma scale. We use that scale to test your consciousness. So there's 3 categories what we would test for, which is going to be your eye response, which was normal as we talked about, your motor response, which so far it seems like you have no problem with range of motion or mobility. And then also your verbal response, which indicates that, like, you answered the questions such as you know where you are, you know why you're here, all of that. So generally you want your score to be between the ranges of 13 and 15. And it seems like you're within that normal range, so you have no problems there. So I'm going to move on to your musculoskeletal exam. Now, do you currently have any problems with any kind of joint or movements, any pain?
No.
No? Okay. All right. If I can just get you to sit up straight for me, you can just kind of scoot to the edge. What I'm going to do is I'm going to check 2 joints on your upper body. So I'm going to check your elbow, and I'm going to check your wrist, and then I'm going to move down to your lower body, and I'm going to check your knee, and I'm going to check your ankle, okay?
Okay.
All right, so we'll start with your elbow. So if I can just get you to bring it up and then bring it down. Okay, now this time I'm going to push against you. I want you to push against my hand going up and push against it going down. Okay, there was no pain while doing that?
No.
All right, so we'll go ahead and move to your wrist since we're on this side. So I'm going to hold it, turn it like this for me. So I want you to extend it, flex it, and then hyperextend it. Okay, so no pain while doing that, right?
No.
Okay, so push against my hand, and again. Okay, so now we're going to move to this side. So again, I'm going to hold your elbow, and I want you to bring it down, and then bring it up. Do it one more time for me. Bring it up, and no pain while doing that?
No.
Okay, so push against, and one more time. Hold on, turn your arm back this way. Okay, there we go. All right, now we're going to turn your hand this way, and I'm going to check your wrist. So if you want to flex it for me, bring it up, and then hyperextend it. Okay, now push against me, and again. All right, so this time, like I said, we're going to move down to your lower extremities. I'm going to start with your knee. So I'm going to hold back here on your calf, and I want you to stretch your leg out and then bring it back in. Okay, no problems while doing that?
No.
Okay, so now I want you to push against me and push against my other hand. Okay, we're going to do the same on this side. So again, bring it out. Now bring it all the way back in. Okay, now push against me. One more time. All right, so now we're going to move down to your ankles. Okay, so I'm going to hold your ankle. And I want you to kind of pick your foot up, and I want you to point it down, and then bring it, push it. Yep, there you go, point your toes up. Okay, now push against me. One more time. Okay, I'm going to swap and do this ankle. All right, so again, just point it up. Now point it down. Okay, push against me. And again. Now, did you experience any kind of pain or discomfort while you did that? I heard it pop. Was that your knee that popped when we did that?
No, my ankle.
Okay, did it hurt or anything like that? No? Okay. All right. Let's see. So you feel like overall you have pretty good range of motion in your extremities?
Yes.
Okay, good. All right, now I'm going to check your balance and your gait. Your gait is what is just like your walking in general. So if I can get you to stand up for me. And what I want you to do is just walk a normal straight line. I'm just going to observe how you walk. Okay, so you seem to walk very normal, good pace, very balanced, no problems with that. And now I want you to do the tandem walking, which means we're going to do heel, toe, heel, toe. So that just checks your balance, so we can make sure you're not having any issues there. Okay, you can come back. We have one more test to do, the rompers test. Now, I want you to stand with your eyes closed. I'm going to keep my arms at your side in case you feel like you're going to fall. And this is just going to check your balance. So just stand with your feet together, eyes closed. Okay? And generally, we would do this for 20 seconds. If you sway to a certain extent, we would deem that you were having some balance issues. But everything seems good. Okay. Now, when you sit back down, if I can have you actually lay down, I'm gonna check your we're gonna do your gastrointestinal assessment. So I'm gonna check your stomach. So I just need you to raise your shirt up for me. All right. So just visually looking at it, I don't see any kind of distension. I don't notice. Everything looks pretty symmetrical. I don't see any kind of scars or lesions. Let's see. Everything looks pretty symmetrical, flat, no distension. And I'm going to listen for your bowel sounds. So let's see. And then I'm actually going to palpate. So I'll just kind of lightly push on your stomach, okay? Check for any kind of tenderness. All right, so I'm going to listen in your right lower quadrant. Move to your right upper quadrant. Now, generally, we would listen to these for a minute to make sure we heard bowel sounds, okay?
Okay.
I'm going to move to your left upper quadrant and your right lower quadrant. Okay, so this time I'm going to do the same thing, but I'm going to listen with the other side. Okay? Okay, so that helps us hear for any kind of roots. And when I listen right here, that would help indicate if you have an abdominal aortic aneurysm, which you don't, which is obviously a very, very good thing. So that's all normal. Now, again, I'm going to palpate, so I'm just going to lightly push on those same quadrants, and you just let me know if there's any pain or tenderness while I do that, okay?
Okay.
No pain or discomfort?
No.
All right, I'm going to push just a little bit harder. Any pain or discomfort?
No.
Okay, good deal. All right, now have you, let's see. When was your last bowel movement?
Today.
Okay, was it normal? No, no, any different colors? No bloodiness, nothing like that?
No.
Okay, what about urination? As far as, did the urine seem normal in color? Like, you know, you kind of want that very, very light yellowish color. That indicates like good hydration. We don't want any kind of like foul odors or anything like that. Did it seem normal? Did it have a strong smell or anything?
No.
Okay, no off the wall like gold or amber color to it?
No.
Okay, good deal. All right, well, I'm going to let your doctor know the findings of the assessments, and they'll